So those who are, I'm giving Nysha as a role model now, those who are serious sessions, those who want to do like how Nysha is doing. Okay. So those who want, you can send me a request and I'll take sessions. Okay. So those who are, I'm giving. So, Punita, you are asking for a speaking. Are you interested? You can send. If you are interested, you can send one card and you can prepare that one and be ready. I'll take one. Yeah, Susan. I'm coming for you. You are going to be with me, okay? You are going to be with me. Yes, we are going to spend another 10 minutes or maximum 15 minutes. Then we are going to start the reading and listening. Yeah. Yes. So speaking from the book Official OET. Official OET medicine. So official OET medicine speaking. Sorry, book, practice book for medicine, official. Okay. Yeah. So all of you be ready. The second round will be, yes, reading and listening. Yes. I never mention any time, Dilukshi. I just come on like that, and I'm sorry because I don't know myself what time, what I will do. Okay. I break all the traditions. Okay. So, okay. Right. The next once it's not going to stop. It's next one. Reading. Okay. Right. So here is the speaking. 61. Yeah. Yes, Dr. Nisha. Yes. Have we done this, Nisha? Yes. So in 10 minutes, we are going to start. Okay. Susan, a question for you. Susan. Susan, pharmacist. Can you unmute, please? 1 second. Susan Matthew. Okay. Yes, Dr. Nysha. Unmute.
Yes, sir.
Yeah. Start your video. Yes. So you are on the hot seat now. This is your card. This is your card.
Yes, sir.
You have 3 minutes to prepare. And when you are ready, you can start straight away.
Okay, sir. Can I start, sir?
Yeah. 1 second.
Sure, sir.
1 second. Just let me get the document official. medicine. Okay, 1 second. Let me take this card. So, yeah. So all of you just attend how the session is going on. Yes, Dr. Nisha.
Yes, sir. Hi, my name is Nysha Sharma, and I will be your physician for today. Can you please tell me your name?
My name is Lincoln, Abraham Lincoln, but you can call me Lincoln.
Okay, Mr. Lincoln, what brings you here today?
Actually, doctor, I am a little worried and I don't know what I have to do for this situation. And actually, I have had a fright. I had a bad bout of flu recently and I feel increasingly short of breath. And I have dry throat too. And, this morning, I thought I was going to die because I couldn't catch my breath. I'm worried that it is asthma.
Oh, Mr. Lincoln, I'm really sorry to hear that. It must have been really stressful for you. What do you know about asthma?
I don't know anything about asthma, but I have seen some people suffering from that. So I don't want to have that problem. So I'm worried. Can you please explain me, doctor, what is asthma? What causes asthma? And how can asthma be treated?
Well, sure, Mr. Lincoln. So asthma is a condition that affects your lungs and it can cause you to suffer from air hunger. You might just feel the tightness of chest, and it might be very difficult for you to take breath like you had experienced. And the cause of asthma is different for a different individual. It can be because of environmental factors like pollen, or it could be because of the hair of pets, or it could be inherited. That means that there might be some familial history of asthma that might have been passed to you, or it can also be because of flu that you had recently had. So flu can be one of the causes of asthma.
Okay, what am I supposed to do now, doctor?
Are you ready to discuss further for the treatment of asthma?
Yes, please. Sorry for the interruption.
Sure, sir. The first line treatment of asthma would be Ventolin or salbutamol. So Ventolin or salbutamol is generally suggested as first line treatment for asthma. It is a short-acting drug that can help you acutely with the asthma, and it's very easy to use and it's very easy to carry around.
Doctor, I'm worried about what you're telling. I'm not very comfortable. I have concerns about your proposal of using Ventolin, because I heard people, number of them, that it has been misused. So I don't want to have any trouble.
Yes, I can totally understand your concern, and your health is my priority. But amongst all the available drugs or the pharmacological management of asthma, Ventolin or salbutamol is supposed to have a lesser side effect. And since we are using it whenever it's necessary, so I don't see any addiction with Ventolin.
All right. And doctor, I am worried and anxious about my condition. I have heard stories of people dying from asthma attacks. I'm literally scared. I don't know what to do, doctor. Can you please help me?
That is totally understandable, Mr. Lincoln. Yes, but there is nothing to worry about, because if we can identify trigger, like what is causing your asthma, and if we can properly manage it, then there is nothing to worry about at all, because the prognosis of asthma amongst the other disease is very good if it's taken care properly.
Is there anything else that I should know in this concern, doctor?
Number one is finding out what exactly is causing your asthma, like your trigger. And the second would be just taking the drug whenever you have the attack of asthma.
Right. Thank you very much, doctor. That's so nice of you. You have given a clear picture of what my situation is. I thank you once again. Have a nice day.
Is there anything I can do for you, Mr. Lincoln?
No, doctor. Thank you.
Thank you.
Right. So, doctor, your style is good. Your fluency is fine. Your pronunciation is better than many others. And you have a style of your own. You have already practiced some sessions with me. And okay, fine. That's absolutely fine. But now I've already posted this audio, video on the YouTube. You can just okay, get it the audio, and then you can try how you can use passive voice and how can you can enhance sentence. You have used one sentence. Let me tell that sentence what it is. You have told, if we can identify the trigger factors. Is that correct?
Yes, sir.
If we can identify the trigger factors, then we can, you said something else. Okay, that forget. If we can identify the trigger factors. So why do you want to use we? Because I cannot identify. Only you can identify. So you, by default, you made a sentence mistake. If we means who? Are you including me also? I can identify the trigger factor. Or maybe, right, you are. Maybe I cannot identify still. Maybe you are the only person, or you and some other person. See, a lot of questions are there for me. If you do not use the word we, you have brought a question, who should identify now? When you said we should identify, if we can identify, can we identify? Is the another big question now. Can we identify is the big question. And who should identify? I or you or both of us or you and somebody else? Now, I think you understand the dilemma. You have given big percent for me. I'm just giving you, because just because you have used active voice, you are right. You are right. That's absolutely 350 marks. You are safe zone. You will not get less than 350. That's no doubt. If my expectation is right, you will get for this speaking test 380. That's what it is. So now if you can say like this, all these doubts will be lost. See, I got so many questions. If we can identify the trigger factors, if we can we identify? That's the first question. Now, second question is, who should identify? That's the second question. Third question is, am I included in that one to identify? Is the third question. So you can see the questions. Put a big question mark there. 1, 2, and 3 questions. Now, if you avoid we, then if trigger factors are identified, okay. So why are you raising a doubt there? That means, can't you identify? Is it a 50-50? If we can, possibility. If we can, conditional possibility. That means, are you not sure that you can identify the trigger factors? So what if the trigger factors are not identified? That's the point. So how you have to speak this sentence? First and foremost, the trigger factors will be identified. Who is not your problem? Not my problem. That is what you mean. If I am doctor in your place, if I am Nysha Sharma and you are Mr. Peter, the patient, I will tell like this. All the necessary measures will be taken to identify the trigger factor. All the necessary measures will be taken to identify the trigger factors. Trigger factors will be identified by using all the possible measures. Finished. That means there is no problem. They will be identified. Confirmation is there. If trigger factors are identified, if we can identify the trigger factor, if we cannot, some other doctor will identify. Then why to come to you? Dr. Nysha, am I with you?
Yes, sir.
Is that clear?
Yes, sir.
So why are you using active voice? That is right. No doubt your sentence is right. But when you're capable, see, yesterday I have shown Apurva, she got 460 speaking. Why you cannot get? Definitely you can also get. You can just type Apurva.
Sure, sir.
And then in the Telegram channel, and you'll get the audio, you can listen to that. So you also can try. There is nothing to worry about your condition, because this is quite common among many individuals who are facing the same problem. First and foremost, all the necessary measures will be taken to identify the trigger factors. Passive voice. No, I, no, we, no, you, I. You're not telling that you are doing, you're not telling that I should identify, nothing else. Trigger factors are important. Or all the necessary measures are important. Or trigger factors will be identified by using all the necessary measures. So like that. And consequently, remedial treatment will be provided. Finished. Education will be provided regarding the treatment plan. Finished. Where is I? Where is we? Is that clear, Nysha?
Yes, sir.
Take this letter, because tomorrow I want your style totally transformed. Okay?
Okay. Okay, sir.
Not tomorrow. Maybe anytime I'll call you. And I'll take the same speaking session.
Okay, sir.
Okay?
Okay,
Write
sir.
all the answers for these things. Write all the answers. Whatever you have spoken, you write them as it is. You go to the Telegram chat, you go to the YouTube, whatever you spoke, you can write them down.
Sure, sir.
Or you need not go there. You can write, you remember everything. You are not a dull head. You are very wise, okay? You're a doctor, right?
Yes, sir.
You are not simple Simon. You are perfect Peter. Okay. You understand what I mean?
Yes, sir.
So that's what it is. So you can write your sentences, improvise your sentences, qualify them with quality vocabulary. Try to remove, first write down as you want. However, first draft, write everything, whatever you want to write, you write. Then improvise that one. Okay.
Yes, sir.
Tomorrow, I want the transition from imperfection to perfection, active to passive, ordinary to special.
Sure, sir.
Is that clear?
Yes, sir.
So that's it. That was nice. You have done very well.
Thank you, sir.
Good.